Hello friends, today I am going to tell you 10 different signs by which you can easily identify a patient who is suffering from some hematological diseases. So let's get started with such different signs of hematological diseases. Friends, the first and important most sign of the hematological diseases is pallor. So the first important sign is pallor. So what is pallor? Pallor is the paleness of the skin as well as mucous membrane, and the pallor is on account of anemia. So friends, what are the four different sites where you can examine pallor? Pallor can be examined on the nails, on the conjunctiva, on the oral mucous membrane as well as on the palms. The second important sign of hematological diseases is icterus. So what is icterus? Icterus is again nothing but the yellowish discoloration of the skin and mucous membrane. Just like pallor, icterus can also be visualized on four different locations such as conjunctiva, oral mucous membrane, nails as well as skin. The third important sign, physical manifestation of the hematological diseases is lymph node enlargement. Lymph node enlargement, and the clinical term for enlargement of the lymph nodes is lymphadenopathy. So friends, do not forget to see for the lymph node enlargements in different sites. The most commonly affected lymph nodes in the hematological diseases are cervical group of lymph nodes, supraclavicular group of lymph nodes and axillary group of lymph nodes. Remember, lymphadenopathy is a very common finding in cases of leukemia. The characteristic feature of lymphadenopathy is in most of the leukemias you get contiguous or continuous lymphadenopathies that will be seen on only one side of the diaphragm. But in various leukemias you can also see bilateral involvement of the lymph nodes. These lymph nodes are painless. Remember my friends. Coming to the fourth sign of hematological diseases, it is sternal tenderness. Sternal tenderness. That means the patient complains of pain when we touch to the sternum, when we palpate the sternum. Sternal tenderness is a kind of bone pain. And again, this is a sign of leukemia. So if a patient comes to OPD, says I am having pain over here, then it indicates sternal tenderness, which is a sign of leukemia. The fifth important sign of hematological diseases is hepatosplenomegaly. Hepatosplenomegaly. Hepatosplenomegaly, again, it is seen in cases of hemolytic anemias as well as in cases of leukemias. The sixth important sign of hematological diseases, it is the purpura and petechial hemorrhages. Purpura and petechial hemorrhages. Petechial hemorrhages are very small pinhead sized hemorrhages which are seen below the skin. I will show you the images of them in a while. So petechiae and purpura, they are signs of thrombocytopenia. If the platelet count starts to decrease, the person presents with petechial hemorrhages or purpura. Another sign of hematological diseases is chipmunk faces. Remember friends, chipmunk faces. This is a very characteristic typical presentation of a face of a person who is having some hemolytic anemias, and commonly it is seen in cases of sickle cell anemia. Friends, in this chipmunk faces, the patient's face appears like that of a face of a squirrel. So see for such presentation in the patients. Another sign of hematological diseases, it is called as hair on end appearance. Hair on end appearance. This is seen on X-ray, and most commonly it is seen on the skull bone. On the X-ray you will see small multiple white colored projections coming out of the skull bone. Again, this is a sign of thalassemia and sickle cell anemia. Coming to the another sign of hematological diseases, the patient will present with tachycardia, the patient will present with hypotension, and the patient will also have cold, clammy skin. Now let us see some of the images of these so that it will be easier for you to understand. See, the first thing, we will start with this image. Here you can see pallor on this portion. See marked white appearance, whitish appearance on the conjunctiva. The patient is having pallor. If you are unable to diagnose pallor, you can simply compare your hands, your nails, color of your nails, color of your palms with that of the patient's nails or palms, and you can compare the pallor. The second important sign of hematological diseases, as I said, is icterus, and C for icterus. Once again, C for the yellowish discoloration of the eyes. This is icterus. Another sign, it is the sign of anemia, which is iron deficiency anemia, and in iron deficiency anemia, C for the spoon shaped deformity of the nails. C for spoon shaped deformity of nails. This is clinically called as koilonychia, and koilonychia, if it is present, it indicates iron deficiency. Similarly, vitamin B12 deficiency presents with three different signs. The patient will have glossitis, angular stomatitis, and cheilitis. I will show you some images. In this image, see at the angles, see at the corners of the mouth. They are ulcerated. This is called as angular stomatitis. And in this patient, look at the lips. Here you can see that the skin over the lips, it is getting peeled off. That peeling of the skin from the lips, it is called as cheilitis, C-H-E-I-L-I-T-S. So positive angular stomatitis, positive cheilitis indicates that the patient is having B12 deficiency anemia. One more sign of hematological diseases, as I told you, C for petechial and purpuric hemorrhage. Here you can see many small petechial hemorrhages, pinhead side hemorrhages, multiple small pinhead sized hemorrhages. These are all petechial rashes. It indicates thrombocytopenia. One more sign that you can get in hematological diseases, it is called as hypertrophied gums. Again, look at the appearance of the gums in this patient, and see for excessive redness, swelling present on the gums. These gums are very painful to touch, and sometimes you might see blood oozing out from the gums. Such hypertrophied gums are the indicators of leukemia. Coming to the another sign of hematological disease, I have told you about lymphadenopathy, and in this patient, see for multiple lymph node enlargements in the retroauricular region, as well as submandibular region, as well as cervical region and supraclavicular region, and see for the involvement, it is continuous, retroauricular followed by submandibular, cervical and supraclavicular. It is continuous involvement, and these lymph nodes are painless and they are present on same side of the body. This is a sign of leukemia. Remember this. Coming to another sign of hematological diseases, one more patient of lymph node enlargement. I hope you can guess this lymph node now. This is a cervical group of lymph node. Another sign of hematological disease, as I told you, the patient has hepatosplenomegaly. Look at this child. And C for this portion, distended abdomen. This is the region of spleen. The spleen is enlarged massively. First of all, it has involved the entire thoracic cage. Once all the space has got occupied in the thoracic cage, now the spleen has started descending down into the abdomen and has started enlarging into the abdominal cavity. And in this portion, you can see the enlarged liver. So this is hepato and splenomegaly. Remember, hepatosplenomegaly, it is seen in hemolytic anemias as well as in some cases of leukemias also. Coming to one more sign of hematological diseases, sternal tenderness. See, at this location, at the center of the chest wall, the areas which are marked in red, these are all the areas of pain in patients, sternal tenderness. This is bone pain seen in cases of leukemias. Coming to the characteristic chipmunk faces, look at this boy and see for his enlarged maxilla, enlargement of the maxillary bone, depression of the bridge of nose. All of this is peculiar in cases of, this is peculiar of chipmunk faces. Chipmunk, it resembles, why it is called as chipmunk? Because it is resembling with that of the face of squirrel. You can see the enlargement of the maxillary bone. So as it resembles with that of a squirrel, we call it as chipmunk faces, and this is characteristic of, once again, leukemia. See for this one, the protrusion of the jaw bones, maxilla, the protrusion of the teeth, and the depression of the bridge of nose. Coming to one more sign of hematological disease, see for this X-ray. And here you can see multiple small hair-like projections. This portion, I will just zoom in now. See for multiple small hair-like projections growing from the skull bone. This is called as hair on end appearance. And hair on end appearance, it is indicator of the sickle cell anemia and thalassemia. See, in this X-ray, I will zoom in and you can see the hair-like projections on the skull bone. This is what is seen in cases of hemolytic diseases. So I hope you have understood some of the signs of hemolytic diseases. Apart from that, C for, as I told you, C for tachycardia, hypotension and cold clammy skin. The more the signs positive, the more are the chances of the patient suffering from diseases related to hematology. Thank you.